Thank you very much. Case counts for the coronavirus infection are falling. I'll update you on that, and I'll update you on where we are with our vaccine availability. Here are the numbers on the cases. We've had 382 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed cases of 106,976. That's confirmed. In addition, we have 139 new probable cases by the rapid antigen test. For the past week that ended January 30th, we averaged 388 cases per day. That's PCR and antigen combined. So far, we'll have more that'll be reported later. And of those people tested, 6.0% of the tests were positive. Now for the previous week, January 17th through the 23rd, we averaged 424 cases per day and 6.7% of the tests were positive. Now those case counts are still high. We still need to take precautions, but it is good to see the downward trend. On deaths, we have 12 new identified deaths since yesterday, bringing us to a total of 2,886. Now we peaked at over 100 deaths per week in late December, but in January we're averaging about 80 deaths per week. And I believe that decline is because of the lower case counts. That's a good thing. Still, the number of deaths we're getting is far too high. So now we talk about vaccination. We are making progress, but it is slower than I would like. Here's the progress so far. We continue to have a very limited supply of vaccine. We're receiving about 10,000 doses each of the Moderna and the Pfizer vaccines. Now the Pfizer vaccine, I should say, is much more difficult to deal with than the Moderna vaccine. It needs to be stored in those ultra cold freezers, minus 70 degrees, which means it needs to be stored mostly in hospitals that have those freezers. And there are complicated mixing and use requirements that limit on where the vaccine can be used. We've been delivering the Pfizer vaccine and the Moderna vaccine to people in phase 1A. Those are healthcare workers and people who live in nursing homes. Now we finished the first round for most of those healthcare workers, the first dose, but not all. And in most cases, we're now on the second dose for those healthcare workers. Just over the weekend, I was at a mass clinic for home health aides in West Philadelphia. And they vaccinated about 500 people in a day. This was a clinic that was run by the health department. Now, in total, we vaccinated 105,306 people. That's for the first doses. And then 36,348 received the second doses. Now, that's nearly as many first doses as diagnosed cases of COVID over the last 10.5 months. Now, that's what overall, while that's going on, teams are going to nursing homes, and the nursing homes teams have visited 53 nursing homes, assisted living facilities, and personal care homes. There's 46 nursing homes. They're moving into those other facilities. They have about 100 facilities still to go to many of these facilities. And their second visits are underway for the first nursing homes that had their initial visits. Total, they vaccinated 5,800 residents and 5,100 staff. Now we are now in phase 1B, and we're going to be in phase 1B for many weeks. We're starting at the top of the priority scheme for phase 1B and working our way down. That means we're going to be vaccinating frontline essential workers. That has started, and that will continue. We're vaccinating first responders, people in the city's jail, service providers who work with vulnerable populations, and soon we'll be vaccinating people who work in transit. We're vaccinating people who live in congregate settings and work in congregate settings like behavioral health facilities, and people over the age of 75, and people who have high-risk medical conditions, especially cancer, chronic kidney disease, organ transplant, and diabetes. Now, how's the vaccine being made available now? I thought I'd just sort of give people the scope of what's going on. The hospitals are inviting their patients who meet those high-risk criteria to come in for vaccination. Likewise, the federally qualified health centers and other clinics like them are inviting their patients to come on in and be vaccinated. Then there's the vaccines I talked about in nursing homes, assisted living facilities, and personal care homes. And there are vaccinations going on in the city's jail. The Rite Aid pharmacies in the city, there's 26 of them, they are vaccinating healthcare workers. And there's a site that is run by the Department of Public Health, us, that's vaccinating about 500 to 600 healthcare workers, mostly healthcare workers, per week. In addition, the health department has mobile teams that are going primarily to behavioral health facilities. They're working about 5 days a week since just before Christmas, and they're doing about 500 to 600 people per week. And then there are mass clinics that are operating. There's mass clinics operated by the health department, which are vaccinating still healthcare workers. 5 of those clinics have operated so far, and they've vaccinated about 1,800 people. And there's the Black Doctors COVID Consortium that is vaccinating. It's my understanding of 3 clinic visits this week Next week, they may be doing 3 or 4 mass clinics. Now, let me give you a sense of how vaccine is going to be made available in the future. The health department will be taking on the job of managing the second dose clinics for those patients who got their first dose in the clinics operated by the Philly Fighting COVID group at the convention center. The first of those clinics will be tomorrow, February 3rd, and it'll continue this week through February 6th. This week, we'll vaccinate about 2,500 people with their second dose. And the press is going to be invited to this vaccination site tomorrow. Then next week, February 9th through February 13th, we will be vaccinating about 4,400 people who received their initial first dose. Now, the health department also will be doing a new set of mass clinics that will begin in the week of February 22nd. The idea is these will be taking place at several sites around the city. There'll be 3 first dose clinics and then 3 second dose clinics per week. And we target about 500 patients per day. We'll be inviting people based on those who have gone to our vaccine interest sign-up form who meet the phase 1B criteria. We'll be emailing people and calling those people to sign up for appointments between now and February 22nd. While we're doing that, we are encouraging hospitals to run mass clinics in addition to what they're currently doing with inviting their patients in. Nothing to report on that today, but we hope to report on that more soon. Also, we are expanding the availability of the vaccine at pharmacies for people over the age of 75. This week, ShopRite will have that vaccine available at 3 locations. Walgreens will have it available at 20 locations. The scheduling for that is going to go live later this week. So we will be contacting people who sign up on our vaccine interest form who are over the age of 75 by email and by phone, and either directing them to sign up schedule their own appointments or helping them schedule appointments. Now, Rite Aid, that is, as I said, still working on healthcare workers, will switch to people over the age of 75 later this month. And there will be more pharmacies that will be offering this vaccine in the future. Now, to step back, I'd say I realize that there are many, many people who want this vaccine who are having difficulty getting it. Many people are very frustrated by where we are. Let me be clear on what we're trying to do. We have 3 guiding principles. We're trying to do this fast. We're trying to do this in the way that will save the most lives. And we're trying to do this with racial equity. Let me be clear, we have more to do in each of those areas. I do believe that we in the Department of Public Health can succeed in doing that. It's still early, only 7 weeks into this, and it's going to be going on for many months. So we ask people, just give us time to show that we can do it. So what should people do if they want vaccine? Well, if you think you're eligible in phase 1B because of your job, the nature of the work you do, talk to your employer. We likewise will be on the other end talking to employers about making it available to employees who meet those criteria. If on the other hand, you think you're eligible because you have a medical condition that is considered a high-risk medical condition, or you're over the age of 75, you can check with the clinic or healthcare system where you get your care. Or if either one of those aren't possible for you, or you simply are interested, then go to our website, www.phila.gov/vaccine-interest, one word, and put in your information, and we'll contact you when vaccine opportunities become available. Now, let me just give you an update on our safer at home restrictions. Just to remind you that about 2.5 weeks ago, on January 16th, we backed off cautiously on some of our restrictions. We allowed indoor dining at restaurants with a maximum seating capacity of 25%. Now we're working with restaurants on standards for ventilation that would have to be met in order for them to increase that capacity. We have not finalized those standards yet. We're still working on it actively. We hope to have those we can announce soon. We continue to not allow indoor catered events, indoor social gatherings of any size, because those are the primary way that the virus spreads between households. When people get together indoors without wearing masks, particularly if they're familiar with each other, that's the highest risk situation. So what should people do right now in this epidemic? Well, first, let me just point out, as much as this is a discouraging fact, it is true, the vaccine will not help us get through this winter wave. We simply don't have enough doses going out to enough people. Everyone needs to keep up their masks and their distancing for now. No indoor gatherings, no parties, no inviting friends over to your place, no visiting people at other places, no inviting your relatives over, no sleepovers for the kids. So, and also plan now, no Super Bowl watch parties. If you do get together, do it outside wearing masks. And these are the precautions for everyone, whether you're vaccinated or not. All of our information is at our website, www.phila.gov/COVID. Thanks.
Thank you so much. Good afternoon, Dr. Farley. The White House just announced 40,000 pharmacies across the country that will become vaccine distribution hubs for eligible groups. You mentioned a couple of pharmacies in Philly. Are those going to be the ones that are included? Can you talk about, will the health department be supplying vaccine to them? How much vaccine? And who's going to make sure that the people vaccinated are eligible at these pharmacies?
Yeah, Mitch, the notice of that just came through as I was preparing for this press conference, so I only know a couple of facts about that. The good news is this is going to be federal vaccine. It won't be the vaccine that we have got stored here, so that's additional vaccine coming to the city of Philadelphia. But we don't know exactly how many doses we're talking about. It will be at Rite Aids. So as you know, we have 26 Rite Aids that are currently offering vaccination. My understanding is that this will be additional Rite Aids. And there's another, ShopRite is also, Topco is the national chain, but ShopRite is a local name for that. So it'll be available through those pharmacies as well. And so that availability, I don't know how many doses it is. The availability is welcome. They say that they're going to be vaccinating people who meet local criteria, but I don't know yet what the mechanism is for ensuring that.
Are you responsible for shipping the vaccine, or is that going to be directly shipped by the federal government?
Directly shipped by the federal government is my understanding.
Okay. And through last week, you talked a little bit about getting hospitals to do mass vaccination clinics. Through last week, the Department of Health reported 85,000 doses or so that were shipped and given to local hospitals. How many of those doses are still available? And what is the plan exactly to use them from your direction? How long do you think it'll take to get those in actual arms?
The hospitals are making a transition between vaccinating their staff, which operated very quickly, to vaccinating their patients. And we're learning that it's much slower to vaccinate patients in the way that they're doing it than when they vaccinated their staff. And so that's why they're vaccinating the patients now. They need to, we've encouraged them to do additional mass clinics because they do have vaccine in storage. We can get you some numbers. And so they do have enough vaccine in order to do those mass clinics. And they're going to need to do that in order to spend down the vaccine they have.
Okay. And one question I want to ask you about the Johnson & Johnson vaccinations. If the FDA authorizes that single shot in the coming weeks, do you have any expectation for when you might see the first doses in Philadelphia? And can you walk through how you envision the physical distribution of a single shot vaccine working in the city?
Yeah, so I just got a little bit of information yesterday about this approximate schedule, and approximately this vaccine may be available to us in Philadelphia on March 1st. But there's a big but here. The number of doses they have to distribute nationally, as they said, between 1 and 2 million. So that ends up being a very small number of doses in the city of Philadelphia, perhaps 7,500 doses. This vaccine has the advantage, as you said, it's only 1 dose instead of 2. The disadvantage is that it doesn't appear as quite effective in preventing infection as the Moderna vaccine and the Pfizer vaccine, but it does appear to be quite effective for preventing serious disease. So if you get an infection, but you don't have a serious disease or don't die from it, there's still a benefit to it. So we will be promoting that vaccine. We've yet to figure out what is the best place to do that. I would think that the best sort of recipients of the vaccine would be people that you might have great difficulty finding for a second dose. For example, people who are homeless. And so we're going to try to figure that out what's the best channels for it and have that plan in place by the time it's available to us.
Thank you, sir.
Thank you, Dr. Farley. Thank you, Mitch. Next up, we have Laura McChrystal at the Inquirer. Laura, you should be able to unmute and ask your question.
Hi, thanks. Dr. Farley, do you have an update on the racial breakdown of vaccinations so far and whether it has improved over time with the racial equity?
Yes, so as of this morning, about 15%, a little more than 15% of the people vaccinated were African American. I don't have the other numbers for you. That's up from 8% when I first saw it. So it's moving in the right direction. It is still far too low, and it's not moving up fast enough. So we clearly need to redouble our efforts to make sure this vaccine is made available and is in a way that's acceptable to African Americans and other minority populations in the city.
Okay, and one of the changes or suggestions outlined in a letter that Mayor Kenny sent to you last week was increasing doses given to the Black Doctors Consortium. Has that happened yet?
It has. This week they're getting approximately 2,000 doses. My understanding is next week is 2,500. Last week, I think they got 1,000.
And also we assisted as a matter of fact, I had a night phone call with Dr. Stanford. They had an unexpected change in location for their mass clinic today. They worked something out with Temple University and Leah Core Center. We assisted them with police coverage, traffic police coverage to make sure that it ran in an orderly fashion. That clinic today is on from noon till 8 o'clock tonight. And again, they pivoted quickly at last minute's notice, and they're out there today doing vaccinations.
Thanks. And my last question, Dr. Farley, you mentioned that the pharmacies will begin vaccinating residents 75 and up. To clarify, will the sign up for those sites also be through the city and the online interest form, or would people call the pharmacies directly?
So the people who have signed up on the interest form will get a communication from the city that says, here's how you can sign up to the pharmacy. The pharmacies don't want to post a link open to the web for fear that it may be shut down, or they may have a lot of people who are not over the age of 75 who are signing up there. So we're going to try to have it be referred to the vaccine interest form. So I would recommend if people want to receive vaccine there, they go through our form.
Thanks.
Thank you, Laura. Next up, we have Jack Tomczuk at the Metro. Jack, you should be able to unmute yourself.
Thank you. This is for Dr. Farley. As you may be aware, the school district is installing thousands of window fans to improve airflow. Do you think this is an effective way of preventing COVID-19 inside a classroom?
I think it's a good idea. You know, I was surprised to learn when I got into this that window fans can really make a big difference in the amount of ventilation that takes place. And, you know, they're inexpensive. It's a way to do it. It makes the rooms cold. But we do think that this virus is spread in large part, not entirely, but in large part through the air. And so if you increase the ventilation, that should lower the risk. That's why we think outside is much safer than inside. And again, we have an inexpensive solution. Let's use it.
Well, just as additional information, apparently there's about a third of the fans that have been installed to date. The school district requires the room to be at 68 degrees at least. They've tested those fans, some of those fans they've installed, and the temperature has stayed at the appropriate 68 degrees. But the airflow allows for safely support 18 people in a particular classroom without social distancing. So it seems like a simple solution or a simple way to address the problem. But if it's effective, it keeps the room temperature stable and it keeps the airflow going. It's a good thing. We try to get them all outfitted by February 8th, which is when we expect school to come back.
Thanks for that. And another question for you, Dr. Farley. Are you still anticipating 20,000 doses a week to be shipped to Philadelphia, even into March, or have you updated numbers on that, projections?
The federal government is only giving us projections for the next 3 weeks, and that's what we're getting for the next 3 weeks. Beyond that, we have no idea.
And is there any additional cases of the variant, either the UK variant or any cases at all of the South African variant?
We have not had any reports, excuse me, of the South African variant in the Philadelphia area. We have had, and I'm losing track of the exact numbers, but 3 or 4 cases of the United Kingdom variant. I saw one in an email just before I started the press conference, and so I can't give you an exact number, but we do know that the United Kingdom variant is in the city. We also, as you know, we've only tested a very small number of the samples. So the more that we test, I'm sure the more of that variant we'll find here.
Thank you.
Thank you, Jack. Next up, we have Hannah Chinn at WHYY. Hannah, you should be able to unmute and ask your questions.
All right. Hi, this question is for Dr. Farley. I'm wondering how or whether the past 2 days winter storm has affected COVID vaccine distribution to Philadelphia specifically. Have road disruptions slowed or disrupted delivery at all?
I'm not aware of any disruption. You heard Mayor Kenny talk about the Black Doctors Group. The vaccination that we are doing at our site is still taking place today. Some of our mobile teams will be limited, but I'm not aware that it'll make a big difference.
Okay, but shipment wasn't stopped to the city.
Oh, no, you mean the shipment to the city from
Yeah.
the federal government? I have not heard that being a problem.
Okay, great. And then my other question was, we're hearing stories about those who are ineligible for the vaccine is still in Philly, but who might be eligible in nearby counties because PA's criteria is different than Philadelphia's. Basically, they're maybe between the ages of 65 and 75, wondering whether they can get the shot elsewhere. Do you have any comment to offer on that? Is that something that you're actively discouraging Philadelphians from doing if they're eligible in other counties, but not in Philadelphia where they live?
No, people can do that. There's no restrictions that we have on where you need to be vaccinated. The information can cross lines. Here in Philadelphia, we've vaccinated many more people who live in the suburbs than the suburbs have vaccinated people who are Philadelphia residents. So some going each way. But again, the net is that we're vaccinating more people in the suburbs.
But the bulk, Doc, correct me if I'm wrong, the bulk of those people from the suburbs were frontline healthcare workers working in our medical institutions. So yeah, even though they're not Philadelphia residents, they're working here with our folks and they're on the front line. So we thought it makes sense to get them vaccinated ASAP.
Yes, absolutely.
Okay, thank you, Cyrus.
Thank you, Hannah. Next up, we'll go to Johann Calhoun with Chalkbeat. Johann, you should be able to unmute.
Thanks for having me. My questions are for Dr. Farley and Mayor Kenny. Any chance of vaccinating any of the teachers pre-K to second grade before they return to school Monday?
I would say it's possible. We certainly will not have all of those teachers, not have all those teachers vaccinated by then. So I don't think that the opening school should depend on that. We're going to see how soon we can get teachers started. So it's quite possible to have someone who will start by then.
Okay, what's the timeline for teachers getting the vaccine? Is it still a few weeks away, or has the process sped up a bit?
We're working on a couple opportunities that I really can't divulge at the moment, but we're on it. We know how important it is. We know how important it is to get schools open and get kids out of the house and into the classroom and get parents back to work. So we're working diligently to establish a process to do that.
Okay, majority of the teachers returning Monday will not have the vaccine, obviously. Knowing this, how confident still are you, Mayor Kenny and Dr. Farley, in schools reopening safely Monday? And do you guys have anything planned, like any safety measures or guidelines that the teachers should follow when they return Monday?
Doc?
Yeah, let me just say, there are a number of schools that have been open throughout the entire epidemic. And we absolutely have safety standards and guidelines that are posted on our website that any school, whether it's public or private, needs to follow. If the schools follow those guidelines, their risk of having spread within the school is really very, very low. So yes, I'm confident that we can do this safely. And I think it's very important for the teachers to come back, even if they don't have a vaccine by the time that they're due to come back.
Thank you, Dr. Farley, and thank you, Johann. Next up, we're going to go to David Merle at Philly Mag. David, you should be able to unmute.
Hi, yeah. The first question I had, it sounds like a lot of, and I know this is a question that has come up previously in past weeks, but it sounds like a lot of the planning so far for, the various community sites and the Rite Aids and health department mass clinics are all still sort of being done. The invitations are being given through the city's vaccine interest site. I'm still interested to know, what the plan is for people who are, for whatever reason, don't have as good of internet access and can't, sign up through that mechanism, because it seems like it's still the primary means of receiving an appointment at this point.
Yeah, so people can get on that list and people can be notified in that list, even if they don't have internet access. So they can call the health department. We have a call center that will actually put their information in the database for them. And likewise, when we invite people, we have a call center that will call out and help them schedule an appointment if they don't have internet access.
Doc, you want to give the number if you have it?
Call 311 and have it routed. I'm sorry, I don't have it on the top of my head.
Okay.
I'm sure I can find the number too. Second question, Is there a, do you have like a kind of hierarchy of, for the 20,000 doses that are coming each week? I know there's so many different sites now, but is there kind of like a rough hierarchy of which sites are getting the most doses each week?
No, it's complicated and it changes week to week according to how many doses are being administered. In general, we would expect that the hospitals would be the largest site for vaccination. The hospital has been the largest site for testing. And then the federally qualified health centers, I guess maybe the pharmacies would probably be next once they're fully up and running. And then the federally qualified health centers and mass clinics would be probably next in general line. But again, this is going to change week to week.
Okay. And finally, for the health department clinics that you currently are running and will be running in the future, can you give a sense of how those are currently being staffed? Is that all staff that was already employed by the health department, or are you tapping the reserve corps or hiring contract nurses? How are the staffing breakdowns happening for your own clinics?
It's all of those. So we're using existing staff. We will be using volunteers at first, but ultimately we think this is going to be an ongoing task, so we need to actually hire people to do this. In the short term, we'll redeploy staff to do it, and then we'll hire those to fill them in. But for the people who are actually administering the shots, which is a small number of nurses, we'll probably be using contract nurses.
Thanks.
Thank you, David. Next up, we have Iris Delgado from Telemundo. Iris, you should be able to unmute.
Good afternoon. My first question is for Mayor Kenny. If Armando can go ahead and please translate just so that we have the sound in Spanish.
By all means, Iris, by all means.
Thank
Welcome.
you. Today, February 2nd, Mayor Kenny, what is still not letting you sleep at night regarding the coronavirus pandemic in Philadelphia?
La pregunta para el alcalde Kenny es, al día de hoy, el 2 de febrero, ¿qué es lo que no le deja conciliar el sueño con respecto al coronavirus aquí en Filadelfia?
I stopped sleeping well when I turned 50, so it's been quite some time that I haven't been sleeping through the night. I worry about everything. I mean, I worry about making sure that we get the vaccines distributed, as quickly as possible, as fairly and equitably as possible. I think about the people who are on the front lines working with sick folks. I think of the people who are in the hospitals who are sick and may pass away. I think about the issues that we're dealing with gun violence and poverty and recovering from a crazy presidency. I mean, it's there's a lot to keep you up at night, and I'm hoping that as we move forward in this, and I'm confident as we move forward in this to get more people vaccinated, that'll be one of the less things that I worry about when I try to sleep.
El alcalde nos dice que desde que cumple 50 años ha tenido dificultades para conciliar el sueño y que tiene diferentes motivos que le mantienen despierto durante la noche. A veces se preocupa de todo, incluyendo obviamente la distribución de las vacunas, que se distribuyan de una forma rápida, justa y equitativa para con todos. La gente que está trabajando en las líneas de primera defensa contra este virus, la gente que está luchando contra esta enfermedad y la gente que ha fallecido por ello. También la gente que sufre la violencia por las armas de fuego y la recuperación del país tras una presidencia que ha sido bastante inestable. Entonces hay muchos motivos que lo mantienen despiertos por la noche. Adelante, Iris, con tu segunda pregunta.
Segunda pregunta, Armando. Hace varias semanas se anunció el inicio de la fase 1B, para ser exacta, el 19 de enero. ¿Existe alguna razón más allá de la falta de suministros por la cual se detuvo hasta la fecha?
It was announced around January 19th, the beginning of phase 1B for the vaccine implementation, and it was given as a lack of supplies for the reasons that we're not catching up to that. What is the reason for it?
Production.
I'm not sure I fully understand the question. So we have a limited number of doses of vaccine, and then we have, many different ways of getting the vaccine out. The primary problem is simply the number of doses of vaccine we have. But also, let's remember that the group in phase 1B is very, very large. Best estimate, 400,000 people. 20,000 doses per week. It's going to take us many weeks to get through this phase.
Básicamente, el problema se restringe a la limitada cantidad de dosis disponibles y la manera en la cual estas dosis tienen que llegar al público. Hay que recordar que la fase 1B es la fase más amplia, que incluye 400,000 personas, y nosotros estamos vacunando básicamente 1,200 personas por semana, por lo cual va a tomar un periodo de tiempo más largo.
Perfecto, muchas gracias.
Thank you very
Thank you.
much.
Thank you, Iris. Before we go to the next set of questions, I did want to point out that Mike Dunn dropped the phone number for the COVID call center in the chat for David and anyone else who needed that. Next up, we will go to Martin Pratt with Philly, Your Black News. Martin, you should be able to unmute.
Thank you. Dr. Farley, can you repeat I believe it was a website to go to fill out for interest in the vaccine?
At www.phila.gov/vaccine interest, one word.
Excellent, thank you. And then I'm not sure if you know the address and the change of the location for the Black Doctors Consortium new vaccination center today because of snow.
It was at a church in West Philadelphia. I'm not sure which church it was, but it got moved to Leah Core Center on North Broad Street, a pretty familiar place for people. And you can stay. What they want you to do is stay in your car in line, and you can shelter in your car from the cold. You'll be able to come out, get your shot, get your 15 minutes, kind of not recovery, but 15 minutes of observation time, and then back in your car and go on. So from what I understand, it's working well.
Thank you. That was my questions.
Thank you, Martin. Next up, I have Natasha Brown at CBS, and then we'll go to Max Marin from Billy Penn, and then we can open it up to the second round after those two. So Natasha, you can go ahead and unmute.
Okay, thank you so much. Good afternoon, everyone. This is just for a question for Tumar, if he's still on the call, just about snow removal. Just over the last few days or so, I think we're finally out of the brunt of the storm. I just wanted to either talk to him or the mayor just about the snow removal process, how they believe it's going or it went at this point, and what we can expect over the next day or so.
Sure. Tumar, do you want to jump in, even though we're still in the first round, since we're almost done?
Sure.
Go ahead and answer, Natasha.
Sure. Afternoon, Natasha. We're still currently in the snow removal process. We still have crews out. We expect, actually, the snow emergency was lifted today at 12 p.m. So cars are allowed back on those routes. We think we have good coverage on cleaning those routes. We're going to focus tonight and into tomorrow on our residential streets. But as always, folks could call 311 if they have any complaints or want to get us a list of blocks that we may have not covered correctly. But we'll still have a considerable amount of resources, both city resources and contractor resources out throughout the night, and tomorrow still fighting the storm.
And I want to compliment and thank our workers for being out there through the cold, in the night, overnight, and every time we have these kind of incidences, they step up and get the job done.
Yeah, and just thank you for that. And one last thing, just about just how this process played out. I know that you guys obviously use the sanitation trucks to help out with the plowing. How effective was that? Were more of those trucks being used this time in light of this multi-day snowstorm that we're seeing, or did that help in any way?
Oh, it absolutely does help, and absolutely did help with this particular storm. I think our plan tonight is to get those trucks back on sanitation duty after 6 p.m. tonight. So we expect that we will likely be collecting Wednesday's trash. Remember, we told folks who were on Monday and Tuesday collections to hold their collections until next week, but Wednesday folks could put their trash out. There may be some delays as we catch up, but we expect to resume sanitation operations tomorrow.
Okay, thank you very much.
Thank you, Natasha. Next up, we have Max Marin at Billy Penn and WHYY. Max, you can go ahead and unmute.
Hi, thank you, everyone. For Dr. Farley, you said the sign up for the pharmacies is expected to go live later this week for ShopRite and Walgreens. Are those signups operated separately, or are they operated by those companies? And is there any data safety concerns that people should know about?
So yeah, each of the pharmacy chains will have their own link. The links are going to be private. We will be sending people links for those who have email addresses so that they can then sign up. We will be calling people on the telephone and assisting them to schedule appointments if they don't have internet access.
Good, thank you. And the Pennsylvania Department of Health is releasing weekly data on the number of vaccines that they allocate to each provider. The city is not doing that at the moment. In terms of, I know that you will provide a certain number of vaccines piecemeal to the Black Doctors Consortium or to this provider. Is there a reason the city's not releasing this data in aggregate?
No, let me take that back and see whether we feel like we can do that.
Okay. and I guess a follow-up to that is, in light of Philly Fighting COVID no longer running its clinic, are those vaccine doses being distributed more widely to hospital networks, any of the city's health networks?
In general, those doses were the Moderna vaccine. The Moderna vaccine is highly sought after because it's a much easier vaccine to handle. And so, obviously the doses that they delivered, those are gone, but that Moderna vaccine is going out to different channels now. It's going through federally qualified health centers. It's going to Black Doctors COVID Consortium, which is getting more doses. Probably, I'm trying to think of other channels as well. Probably some of those pharmacies.
Okay, gotcha. A question, can you talk about why women make up such a large percentage of the vaccine recipients so far? I think it's about 66%. Is that reflective of the healthcare industry or the older population?
Yeah, that's reflective of the healthcare industry. Remember, the vast majority of people in our database who've been vaccinated so far are healthcare workers. We estimated going into this that we would have between 100,000 and 130,000 healthcare workers. We didn't know how many of them would accept the vaccine, but so we're a little over 100,000 people vaccinated. So the large majority of those are healthcare workers, and they're just much more likely to be women.
Okay, thank you.
Thanks, Max. I do see that David at Philly Mag has another set of questions. David, you could go ahead and unmute, and we'll also just do a last call for anyone else who has some second follow-up questions to raise your hand now. David, go ahead.
Great, thanks. Yeah, just this was a question to go off of what Max was discussing, but regarding the pharmacy links that will be sent out, I'm just curious, are those like single-use links that, only that are unique to each individual? Because I think, I believe Philly Fighting COVID had said one of the reasons why they had to turn people away, at least they claimed, was that because people had received links and then shared them with others who were not eligible. So just wondering if there's if there's anything being done to try to prevent that from happening with these new signups.
We would like to have it be where it's a link that couldn't be forwarded and people couldn't get around that. And that's not something we have the technical ability to do right now. So yeah, people could probably forward those links, and some people might get in there who are inappropriate. Now, these pharmacies are vaccinating people who are over the age of 75. They will be asking for some evidence that you're over the age of 75. I can't guarantee that some people might slip through who are under the age of 75. We hope people don't do that. But while we want to get the vaccine into the right arms, we also want to get it out as quickly as possible. So we don't want to put in place such stringent procedures that it slows down the rate at which vaccine is made out.
Cool, that was my only question. Thanks.
Thanks, David. For folks who have their hands raised for a second round of questions, I'm going to ask that you just keep that to 1 or 2, since we do have a handful of people that need to get through a second round. Max, you can go ahead and unmute for your second round of questions.
Just one quick question. Thank you, Lauren. Dr. Farley, you mentioned something about vaccinating the prison population. Has the city gone about starting that process on State Road? And if so, when did you start, and what's the status update on that?
It has started. The first, when we were doing healthcare workers, the healthcare workers at the jail were vaccinated. And now the healthcare workers are vaccinating the staff, and they may be starting with the inmates. I don't have the exact progress. We can check on that and get back to you, but they're working their way through both the workers and the inmates.
All right, thank you.
Thanks, Max. Next up, we have Martin Pratt. Martin, you can go ahead and unmute.
Yes, this question is a simple question. I guess it's Tomorrow or the mayor. What's the schedule for garbage pickup?
Kumar, you want to take a shot?
Hey, Martin. Like I said, Monday and Tuesday collections was suspended. So we've asked those folks to hold their trash until this upcoming week. Tomorrow, we will start on Wednesday collections and try to get through Wednesday, Thursday, and Friday. We expect with some delays, we may go into the weekend. But so for this week, only folks who should put out trash are folks who are on a Wednesday, Thursday, or Friday route.
Got it. Thank you.
Thanks, Martin. Next up, we have Manny at CBS. Manny, you can go ahead and unmute.
Just 2 quick questions. These might be repeats. Thanks to Zoom, we had a little bit of a technical glitch there. Can you guys explain again, it could be Dr. Farley and or the mayor, just talk about the city vaccine clinic process and what you want citizens to know?
Sort of a complicated story, but the city will be managing the follow-up clinics, the second dose clinics for those people who were vaccinated by Philly Fighting COVID. That'll start tomorrow. It'll be tomorrow through the end of this week. And then another group the following week. The city will also be managing clinics that start the week of February 22nd. That'll be for people who meet eligibility criteria who are in our vaccine interest database. And it'll be 3 clinics a week. It'll move around the city, and we'll be inviting people between now and then to schedule for appointments. In addition to that, there are gradually expanded opportunities at pharmacies, excuse me, and we're talking to hospitals about them running mass clinics in addition to the work that they're doing vaccinating their patients.
All right, thank you. Any follow-up, Mayor Kenny, on that, or?
No, that's about it.
All right, and then the second thing is the vaccine hotline. If you can tell us, what it is, when it operates, when people should use it.
Let me get back to you on the exact hours, and the number I believe was put in the chat.
Okay, all right, we'll deal with it from there then. Thank you very much. Well, you know what, if you could elaborate on what type of advice people will be able to get when they call that line.
So this is a general call center we have for the COVID initiative. And so we can answer a variety of questions. And people want to be put into the vaccine interest database and they don't have internet access, we will also provide that service.
All right, thank you very much.
Thank you, Manny. Iris, you're next up. You can go ahead and unmute.
I just wanted to clarify regarding the process of who is going to be vaccinated in the phase 1B. It seems like only firefighters in the jails, policemen. I'm trying to look at my notes here. But what about our teachers, especially now that school is going to be resuming on Monday for the teachers first, of course. Where do they fall in with the stats that Dr. Farley shared with 400,000 people in phase 1B? This seems like it's going to take many, many, many months. But more importantly, what about our teachers?
La pregunta tiene que ver con la prioridad de vacunación para la fase 1B, que según tengo entendido comprende a los bomberos, el personal que trabaja en las cárceles, pero ¿qué hay con respecto a los maestros? Tomando en cuenta en especial de que las clases van a volver a darse presencialmente a partir del día lunes. Según las estadísticas que se mencionaron de 400,000 personas, pareciera que durante la fase B va a tomar muchísimos meses llegar a estos maestros. ¿Qué nos pueden decir al respecto? Dr. Farley.
Look at the our priority listing, which is available on our website for phase 1B. It lists a group of frontline essential workers. And that includes first responders, that's police and fire. I'm forgetting the other ones that are on top of that. Then there's the people who work in jails, service providers who work with vulnerable populations. And then we have food service workers and then teachers. We're generally working, and there's more below that. We're generally working down that in sequence, but we're not going to wait to finish one group before we start the next. So we're making progress in the first few groups. We hope soon to start with the teachers, but there's so many teachers, it's going to take us a long time to work our way through them.
How many teachers exactly?
I don't have that number with me. I can get it back.
Correct me if I'm wrong, I think there's like 7,000. I thought it was.
No, well, I've said teachers, it's actually a broader group. It's anybody.
Oh, it is. It's daycare. It's pre-K people too.
Pre-K, but also the cafeteria staff and the staff in schools. So it's a very large group.
El Dr. Farley nos responde de que hay una lista de prioridad que está disponible en nuestro sitio web y que comprende la fase 1B. Exactamente cuántos maestros están ahí, no sabemos, pero es mucho más de 7,000 maestros porque incluye grupos que sirven al personal que está en las cafeterías de las escuelas también. Por lo tanto, es un grupo bastante largo. Nosotros hemos tenido en la fase 1B a las personas que están en primera línea de respuesta, que incluye al personal de la policía, los bomberos y también al personal que trabaja en las cárceles. Luego al personal que está sirviendo a las poblaciones vulnerables. Y luego tenemos al personal que maneja comida, finalmente los maestros. Por lo tanto, va a tomar un tiempo, pero se va a llegar a todos ellos. Y como indica el Dr. Farley, no se va a esperar a pasar al siguiente grupo necesariamente porque se esté en una fase antes de pasar a la siguiente. Muchas gracias.
Thank you, Armando. Iris, was that the only question for you?
Yes, thank you.
Great. Johann, you can go ahead with your follow-up questions.
Yes. The first one is for Dr. Farley. Does the city have any kind of emergency plan if an incident were to occur Monday at any of the schools?
I'm not sure what sort of emergencies you're talking about. The city is in contact with every school in the city that has a case of somebody with infection to give them guidance on how to handle that. And, you know, isolation and quarantine, or what circumstances a classroom would have to be entirely put into quarantine or entire school. And, you know, we have staff that manage that.
Okay, and this last question is for Mayor Kinney. Chalkbeat interviewed student leaders last week about the vaccines and about schools reopening, and they feel somewhat left out of the discussion. Has the city talked to the students, or are there plans to include youth in the decision-making involving anything with the schools?
I have not spoken to the student leadership directly. I'm not sure if anyone in the district has or not. We can check and see if there's any plans to do that. There's a lot of moving parts in this whole thing, not only moving parts in the COVID issue and the vaccination issue, but the weather and all the other stuff we're dealing with. So I can find out and we get back to you.
Thank you.
Thank you, Johann. We have Laura McChrystal at the inquiry. Laura, you can go ahead.
Hi, Dr. Farley, another question about racial equity and the vaccine. When you said that the city would not yet at this time expand to residents 65 and older and just limit to certain health conditions and 75 plus, partly due to racial equity concerns, have you found that that limitation has made a difference, or is it still mostly a majority of white residents in that age group coming to get the vaccine?
I think it's too early to say. You know, we really just started to get into the phase 1B group. But I mean, what everyone tells us is that the over 75 group is more likely to be white, but the people who have chronic medical conditions are more likely to be African American. And so that's why we wanted the people with the chronic medical conditions to be in that phase 1B group. They, at least at the time we did that, most jurisdictions around the country did not have them in that phase 1B group.
Okay, thanks. And a question for Mayor Kenny. City council members have come out really strongly, pointing fingers at the administration for the Philly fighting COVID issues. How do you respond to their finger pointing? Do you take responsibility for that, or would you push back at that?
I'd like to ask Diana Cortez whether or not this is a Philly fighting COVID question or not. And then if it's not, I can endeavor to answer it.
I'm sorry, Laura, can you repeat the question, please?
I was asking the mayor about his, if he has a response to city council really pointing fingers at the administration and, saying that it's the administration's fault for the Philly fighting COVID issues. And just if he has any response to them, placing a lot of blame on him and the administration.
I think that's still sort of on the verge of the IG's investigation. If that at all changes, we can get back to that question, but that's
Let me just say, I understand everybody's on edge. Everybody's stressed out. A lot of this stress has to do with the fact that we have very little vaccine. So I understand people's consternation. I'm the mayor, so I'm the one who usually gets blamed for most things, and that's fine. And we're working our way out of this problem with the Biden administration and the state and CDC, and we're trying to get as much vaccine as we can. And in the meantime, until that happens, I'm sure there'll be other complaints, and that comes with the territory. So, got my big boy pants on.
Thanks.
Thank you, Mayor. Thank you, Laura. We have one last question from Martin Pratt, and then if anybody else still has follow-ups, you can email those to press@phila.gov. Martin, you can go ahead and ask your last question.
Yes, actually two, but they're really quick. First, Dr. Farley, the sanitation workers, where do they fall on that list that you listed? I didn't hear any sanitation workers.
They're in phase 1C. Those are essential workers that they're not considered frontline because they don't have access to lots of people in the context of their work.
Got it. And last question is, when someone gets the vaccine at a Rite Aid or at a CVS or at a ShopRite, what contact tracing will you have available to follow up with someone that maybe in their 15 minutes, they presented a little woozy or they presented something. And so your department would say, let's follow up with that. Whereas the pharmacy would probably say they're fine.
I'm not sure I understand the question. So everybody's supposed to get observed for 15 minutes after they're vaccinated.
Right.
And if they're okay, then they can go home at that point. The serious events that have occurred, which are very rare, happen immediately after vaccination. And so that should be, give people a margin of safety if they're okay for 15 minutes. Now, there is also a process for people who have health problems that are more long-term to be tracked by that. There's a federal system for that. People get information on that when they're vaccinated.
Will you have access to any information of the people that are vaccinated at these pharmacies?
Yes, everybody who's vaccinated in the city, that a record of that vaccination goes into our database.
Thank you.
Thank you, Martin. That concludes today's press conference. You can always send your questions to press@phila.gov, and we will see you at the next briefing. Thank you, everyone.